Hi everyone, hope you are learning through our videos on mid-diaries. So today let's have a look on parotid gland as well as some question based aspects of parotid region. We all know very well about the saliva. The saliva is secreted mainly by three salivary glands. Among these salivary glands, parotid gland is the largest major salivary gland. As we all know, saliva consists of serous and the mucous secretions. Parotid is mainly a serous gland with only few scattered mucous acini. So that parotid gland produces a serous watery secretion to the saliva. Now, let's focus on the location and the relations of parotid gland. This lobulated gland extends from the zygomatic arc to the upper part of the neck. Y'all can go through slides to get a clear idea on this concept. So while the gland extends from the zygomatic arc to the upper part of the neck, it overlaps mainly two muscles which are most familiar to you all. One is posterior belly of digastric and another one is sternocleidomastoid. When you see the anterior border of the gland, it's irregularly convex, which is formed by masseter muscle. When we consider the bony limitation of gland, it extends below the external acoustic meatus and posteriorly limited by mastoid process. If we look the parotid gland in a transverse section, it looks like wedge-shaped one which consists of three surfaces. Those are lateral surface, anteromedial surface and the posteromedial surface. Now let me discuss more detail about each surfaces. Initially the lateral surface. Lateral surface is covered by superficial fascia and then by the skin. Hope you all know well about the deep cervical fascia. Here, the investing layer of the deep cervical fascia splits and envelops the gland. This envelope of fascia is known as parotid capsule. After it envelops the gland, inner leaf reaches the base of the skull and the outer leaf extends superficially as parotidomesenteric fascia and reaches the zygomatic arc, which is the upper bony limitation of the gland. Most anterior part of the fascia is known as mesosteric fascia, which cover the muscle known as masseter. Also, the gland is overlapped by a aponeurotic system known as superficial muscular aponeurotic system. This superficial muscular aponeurotic system continues above with temporoparietal fascia and frontalis muscle, below with platysma and over the gland with risorius muscle which involve in the facial expression. This envelope of fascia is innervated by the greater auricular nerve. So, when the gland is enlarged in order to any disease, the surrounding parotid capsule is stretched and it transmits the pain to the temporal region and the temporomandibular joint, because the same nerve innervates the skin over the temporal fossa and the auricle. You all can learn more about this while you are learning here. Next, we will focus on anteromedial surface. Anteromedial surface of parotid gland grooves the posterior border of mandibular ramus and also related to the muscles attached to the ramus, those are masseter and the medial pterygoid. There are some structures based as the anteromedial surfaces. We'll see one by one. Parotid duct and the facial nerve branches emerging this surface and passes forwards deep to the anterior border of the gland. And then further back to this, the superficial temporal artery and the maxillary artery leave the surface, which are the terminal branches of external carotid artery. So finally, parotid duct, branches of facial nerve, superficial temporal artery and the maxillary artery pierces the anteromedial surface. Next, we'll have a look on posteromedial surface. Mastoid process and the muscle attached to the mastoid process in contact with the posteromedial surface. These muscles earlier we discussed, those are posterior belly of digastric and the sternocleidomastoid. Medially, this surface is separated from the carotid sheath, which contains the internal jugular vein and the internal carotid artery, by the styloid process and the muscle attached to the styloid process. Those are stylohyoid, stylopharyngeus and styloglossus. So, when the gland is enlarged in order to any disease or any infection, it's compressed again the mastoid process of temporal bone when the mouth is open, because you all know that the posteromedial aspects of the gland is related to the mastoid process. Between the mastoid and the styloid process, facial nerve trunk enters to the gland. Now we will discuss about the relation of facial nerve with the parotid gland. Facial nerve trunks enter into the gland and divided into branches, and those branches communicate with each other and form a plexiform arrangements. Branches of facial nerve run in different directions within the gland corresponding to a destination, like to the scalp, mid-face, low face and to the neck. These branches of nerves should pierce the parotidomesenteric fascia to supply these respective areas. You can study more about the facial nerve under the neurology. By this facial nerve, parotid gland is divided into superficial and deep parts, and there's no any difference in embryological origin of the superficial and deep part of parotid gland. When there is a malignancy on a parotid gland, it will compress the nerve and thereby it causes the facial asymmetry due to the low motor neuron lesion of facial nerve. So, when the parotid swelling occurs with the facial asymmetry, it refers to the malignancy of parotid gland. Any benign tumors, for an example in mixed salivary tumor, also known as PLEMORPHIC adenoma. Parotid gland tumor is excised by carefully preserving the nerve and its branches. So, there won't be any defects in the face. So, that's all about the facial nerve. Now, let's discuss about the structures located within the gland. We'll have a look from superficial to deep. Most superficially, there are some parotid lymph nodes, and then the facial nerve. Next to the facial nerve, retromandibular vein. At last, external carotid artery, and sometimes the branches of external carotid artery. Now, let's see something about the retromandibular vein. Retromandibular vein formed within the gland by the confluence of the superficial temporal vein and the maxillary vein. This retromandibular vein emerges from the lower pole of the gland after divided into anterior and the posterior branches and continues further. Like the anterior branch joins with the facial vein and the posterior branch joins with the posterior auricular vein to form the external jugular vein. Now let's discuss on parotid duct or duct of Stenson. This parotid duct is 5 cm long and it passes forwards across the masseter muscle and turn around at anterior border of the masseter, passes through the buccal fat and pierces the buccinator muscle and opens on the mucous membrane of the cheek opposite to the second upper molar teeth. You can see on this picture. So, when the intraoral pressure is increased, the submucous part of the duct is compressed between the buccinator muscle and the mucous membrane, thereby prevent the inflation of the gland. This parotid duct is palpable over the masseter muscle when the muscle is tensed by clenching the teeth. Commonly, there is an accessory parotid gland which is detached from the original parotid gland. This accessory parotid gland usually lies on the masseter between the parotid duct and the zygomatic arc. Parotid duct and the accessory parotid gland lies on the aponeurotic part of the masseter muscle. Now let's have a look on blood supply, venous return and the lymph drainage of the parotid gland. Blood supply to the parotid gland by the branches of the external carotid artery. Venous return is to the retromandibular vein which is formed within the gland. Lymph drainage initially to the preauricular node which is on or deep to the parotid capsule as well as within the gland, and then to the deep cervical node. It's all about the parotid gland. Hope you all understand what we discussed today. Thank you very much and stay tuned with my diaries. Now let's